Sexual Assault on Campus Awareness Campaign to Prevent Violence, presented by Condra Lopez, John Middlebrooks, Cambry Parker, and Amber Scarborough.
What is sexual assault? It can include rape, attempted rape, drug-facilitated sexual assault, intimate partner sexual violence, sexual coercion, sexual harassment, stalking, groping, fondling, sodomy, and the like. Types of manipulation to look out for sexual assault or to prevent sexual assault. 90% of female rape victims are assaulted by someone who they know. Much like child grooming by sexual predators, college students can be groomed by their predators just as well. So it's good in hand to look out for these common pre-warnings. According to Web Psychology Today and Article 6 manipulations used in sexual harassment, when it comes to predatory or manipulative behaviors, being forearmed is also being forewarned. If you can anticipate these tricks, it's easier to prepare a restraint strategy in advance.
Alcohol and drug influence. Drugs and alcohol have a big effect on sexual assault. There are many different types of drugs that can be snuck into people's drinks that sex offenders are known to use in order to sexually assault someone. A few of the drugs were listed by Emily Granada in her post, The Role of Drugs and Alcohol in Sexual Assault. The drugs were GHP, ketamine, propanol, and ecstasy. These drugs can be referred to as date rape drugs. Emily also says these drugs can cause weakness, confusion, and altered or lost consciousness, which can impair and remove a person's ability to consent to sexual activity. Rapist typology and peripherals to be aware of. Two types of sexual offenders are coercive and relational. Coercive offenders use tactics of threat, violence, and force. They could be a stranger or someone we may know. Relational offenders use tactics of sexual manipulation, grooming, and sexual abuse. This type of sexual offender is the most common. Rapist typologies are categorized by relationship to victim and motivational characteristics. Four types of rapists by motivation are power reassurance. This can also be called sexual aimed rapist. It does not inflict additional injury to the victim. The main goal is the rape itself. Next, we have power assertive or antisocial rapists. They act on impulse, they're controlling, aggressive, often is drug related, they might be intoxicated. This is often an unplanned rape. Anger, retaliation, or aggressive aimed rapists are motivated by power and aggression, and they take pleasure in humiliating the victim. Sadistic rapists repeatedly reenact cruel sexual fantasies of pain and torture, and often extensively plan rapes. Peripherals are atypical sexual behaviors. Some that rapists may have are rhabdomyophilia, pleasure in committing rape, and biostophilia, sexual arousal in assaulting a victim.
College campuses sexual assault statistics. This is very important to promote this campaign, to let other students be aware that this happens and to look out for the dangerous signs. 20% to 25% of college women and 15% of college men are victims of forced sex during their time in college. Nearly 2/3 of students experience sexual harassment. 4 out of 5 rape victims subsequently suffer from chronic physical or psychological conditions. Tools used during the incident. Some tools can be when you are walking at night, you should always have someone with you. And if you are not able to get someone to walk with you, call a friend on the phone while you're walking, or call any kind of an adult or the police if that matter, to maybe they can assist you in directing you home or getting in the police car to drive you home itself. Blue light phones are devices that are placed around college campuses for student safety. You can use those in any case assistance. Do not walk in no lighting areas at night. There are also been research on a new app that will allow you to report any incident as soon as you can at any time from your cell phone. I would also ask your college to see if there's any apps that are available to use. Immediate steps post-incident, campus hospital, police protocols. After an assault, it's extremely important to receive a medical exam. Even if there are no visible wounds, even if you feel humiliated, it's still to take the test so that they can catch the victim, to catch the criminal so that the criminal won't be able to do it again to somebody else. Survivors who intend to report the rape and press charges should avoid bathing or showering until after they receive the care at the hospital or the police unit. A rape kit may also be referred to as a sexual assault evidence kit. The kit contains bags, paper sheets, comb, document forms, envelopes, instructions, materials for blood samples, and swabs. This can be a very intimidating time to do this procedure, but like I said, it's very critical to do it in order to prevent it from happening again and also to seek justice. Trauma for victims. There are many different physical and psychological traumas for sexual assault victims. The following are most common are the PTSD, anxiety, and depression. This can happen for long periods, not just at the moment, but it can happen months, years later. So it's best to seek treatment there and also to seek treatment thereafter with a psychologist.
We will now discuss the sexual misconduct protocol and what to do if an incident of sexual misconduct is reported to you. Sexual misconduct protocol includes, but is not limited to, sexual harassment, non-consensual sexual activity, dating violence, or stalking. Step 1. Inform the reporting party that you are the mandated reporter and are required to fully report complaints regarding sexual misconduct to the Title IX office. If the reporting party does not wish to continue with the complaint, direct the party to a confidential resource option such as a patient advocates or the counseling center. Some of these confidential resources include Health Services, Counseling Center, University of West Georgia Advocate and Crisis Line, National Domestic Violence Hotline, and the National Sexual Assault Hotline. For this particular school, other resources include West Georgia Prevention and Advocacy Resource Center and the Employee Incentives Program. For Step 2, it says care for the student, ensure that he or she is safe, and provide non-judgmental support. For Step 3, make sure the reporting party is aware of the on- and off-campus resources. Again, some of these on-campus resources include the Counseling Center, the Advocate Crisis Line, the University Police, and West Georgia Prevention and Advocacy Resource Center. For Step 4, contact your Title IX coordinator to make the required report. You have the Social Equity Officer or the Title IX Coordinator, the Director of Human Resources and Title IX Deputy Coordinator for Faculty, Staff, and Visitors, Associate Vice President for Student Life and Dean Students and Title IX Deputy Coordinator for Students, and the Assistant Athletic Director and Title IX Deputy Coordinator for Gender Equity in Athletics. Furthermore, these are ways for post-prevention and also ways to get more information and get involved. First, you have the Auntie Sana for individuals who identify as Latinos. Next, you have the Georgeville Heart Foundation, which deals with the effects of sexual assault and rape. Next, you have the malesurvivors.org, which deals with male victims who have been sexually abused or assaulted. Then you have the National Alliance to End Sexual Violence, the National Center on Domestic and Sexual Violence, National Sexual Violence Resource Center, Rape, Abuse, and Incest National Network, Safe Helpline Sexual Assault for the DoD community, which is for survivors of military sexual assault and their families. You have the womenslaw.org, and you also have the EROC, which is the End Rape on Campus, which also has a website at endrapeoncampus.org.